Sacrum is a large, flattened, triangular bone that forms the posterior superior part of the bony pelvis. Articulates on either sides with the hip bones forming the ilio-sacral joints. The upper part of the sacrum is quite large as it is the weight-bearing part of the bone, whereas the lower part, it is quite small and it is free from bearing weights. Being triangular in shape, sacrum has a base. The upper surface is the base, whereas at the lower end we have an apex. This is the apex of the sacrum. It has 4 lateral surfaces. The first surface being the pelvic surface. This is the pelvic surface that is concave and smooth. It also has a dorsal surface. This is the dorsal surface of sacrum that is irregular and convex. Laterally, it has lateral masses on each side. These are the lateral masses. They are formed by postal elements and transverse processes of the sacral vertebrae. When placed in an anatomical position, the pelvic surface, it faces forward and downwards. Moving on to the base of the sacrum. This is the base of the sacrum, and for a clearer view or a better understanding, we'll use this sacral bone. So the upper surface of sacrum, it is formed by the upper surface of first sacral vertebra. The body, as you can see here, it resembles the body of lumbar vertebrae, the 5th lumbar vertebrae. It articulates with L5 at the lumbo-sacral joint. This is the L5 vertebra, the 5th lumbar vertebra, and it articulates with sacrum and forms the lumbo-sacral joint like this. They have an intervertebral disc in between them and it looks something like that. Moving on. The projecting anterior surface. This is the projecting anterior surface. It slopes forward at an angle of 30 degrees and it is known as sacral promontory. It is known as sacral promontory. Vertebral foramen, it lies behind the body, right here, and it leads into the sacral canal. The sacral canal, it is, as you can see, it is triangular in shape. This is the sacral canal and it is triangular in shape. The pedicles, as you can see here, these are the pedicles. The pedicles are short and are directed backwards laterally. These are the pedicles of sacrum. The laminae, they are oblique. The laminae are oblique. The spine, it forms the first spinous tubercle. This is the first spinous tubercle. Spine that originates posteriorly from the junction of the laminae. It projects posteriorly, it forms first spinous tubercle. The superior articular processes, they project upwards. The facets on them, these are the facets. These facets are directed backwards and medially. The transverse processes, these are the transverse processes. The transverse processes are highly modified. Each process is massive and are fused with the corresponding postal element to form the upper part of the lateral mass of the sacrum. They form the upper part of the lateral mass of the sacrum. Right here, as you can see, they're forming the upper part of the lateral mass of the sacrum. Transverse processes are forming the upper part of the lateral mass of the sacrum. The base of the lateral mass, this was the lateral mass, and the base of the sacral mass. The base of the lateral mass, it forms a broad sloping surface. As you can see, it forms a broad sloping surface spreading like a fan. It's like a fan, spreads like a fan, and is known as the ala of sacrum. This is the ala of sacrum. The ala, it is further subdivided into a smooth medial part. This is the smooth medial part and a rough lateral part. It has a rough lateral part and a smooth medial part. The apex of the sacrum, this was the base. We're moving on to the apex of the sacrum. This is the apex of sacrum. And it is formed by the inferior surface of the body of the fifth cervical vertebra. It bears an oval facet. As you can clearly see, this is an oval facet that is present for articulation with the coccyx. The base, the apex. Moving on to the pelvic surface. The pelvic surface, it is smooth and concave. The median area, this is the median area, and it is marked by these transverse ridges. These are 4 transverse ridges that mark the median surface of the pelvic surface of sacrum. These transverse ridges, they end into 4 pelvic sacral foramina. These ridges, they are ending into 4, 1, 2, 3 and 4 sacral foramina that communicate with the sacral canal. They communicate with the sacral canal through the intervertebral foramina. The bony bars, as you can see, these are present between the foramina. These bony bars, they represent the costal elements of the vertebra. They represent the costal elements of the sacral vertebrae, and they end and fuse with the transverse processes of the sacral vertebrae, forming the lateral mass of the sacrum. That's how they form the lateral mass of the sacrum. Further moving on to the dorsal surface of the sacrum. This is the dorsal surface of sacrum. The dorsal surface of the sacrum, it is rough, irregular and convex in shape. It is directed backwards and upwards. In the median plane, as you can see, it is marked by the median crest. You can see clearly in this bone of sacrum, it is in the median plane, it is marked by a median crest. This median crest, it bears 3 to 4 spinous tubercles. These are 1, 2, 3 and 4 spinous tubercles. They represent the fused spines of the upper 4 sacral vertebrae. They represent the fused spines of the 4 sacral vertebrae. Now below the 4th tubercle, you can see this shape as an inverted U. This shape represents an inverted U. Have a look. It has a U shape, but an inverted U. This is inverted U shape. This results from failure of the laminae of the 5th sacral vertebra to meet posteriorly and is known as the Sacral Hiatus. This is known as the Sacral Hiatus. Lateral to the median crest. Lateral to the median crest, the posterior surface, it is formed by fused laminae. Lateral to the laminae and in line with the superior articular processes of the 1st sacral vertebra, there are 4 articular tubercles. In line with the superior articular process of the sacral vertebra, of the 1st sacral vertebra, there are 4 articular processes. They are also fused together, just like the lamina, they were fused together. The inferior articular processes of the 5th sacral vertebrae, they are free and form the Sacral Cornua. This is the Sacral Cornua, just adjacent to the Sacral Hiatus. Moving on to the lateral surface. This is the lateral surface of the sacrum. This lateral surface is formed by the fusion of transverse processes and the costal elements. The lateral surface, it is wide above, as you can clearly see, and it is narrow as you proceed further below. The upper wider part, it bears an L-shaped auricular surface. The upper wide part, has an L-shaped articular surface that faces anteriorly, whereas on the posterior side it has some pits. It is a pitted surface on the posterior side. The auricular surface right here, it is formed by the costal elements. These costal elements, they form the auricular surface. It articulates with the auricular surface of the hip bones and forms the sacro-iliac joint. The posterior roughened patent area, it is formed by the transverse processes. Further below, the abrupt medial bend at the lower end of the lateral surface is called the inferior lateral angle. This is the inferior lateral angle of the sacrum. Moving on to the sacral canal. This right here is the sacral canal of the sacrum. It is formed by the sacral vertebral foraminae and is triangular in cross section. The upper end of the canal, it appears oblique, but actually it is directed upwards in the anatomical position. This is the anatomical position and it is directed upwards. Inferiorly, the canal opens at the sacral hiatus. And laterally it communicates with the intervertebral foramina with the pelvic and dorsal sacral foramina. The sacral canal, it contains the spinal meninges, the filum terminale, the subdural and the subarachnoid spaces. They end at the level of the second sacral vertebra. Therefore, the lower sacral nerves and filum terminale, they pierce the dura and arachnoid at this S2 level. That was all about sacrum.